Hope you're doing well today. Today we are talking about Chapter 21. This is a continuation from our earlier discussion, clients with orthopedic injury or rehabilitation concerns. This is part 2. We're talking specifically about low back. Discussing low back pain, the terms acute, subacute, and chronic are often used to describe different stages or durations of the condition. Here's an explanation of each term. Acute low back pain refers to a sudden onset of pain in the lower back that typically lasts for a relatively short period, usually up to 6 weeks. It can result from an injury, strain, or other factors. Acute low back pain can be quite painful and debilitating, but it often resolves with time and appropriate treatment. Subacute low back pain refers to pain that persists for a duration longer than the acute phase, but is still considered an intermediate stage between acute and chronic. It typically lasts between 6 weeks to 3 months. During this stage, the pain may improve gradually, but symptoms may still persist. Chronic low back pain is characterized by persistent or recurring pain in the lower back that lasts for 3 months or longer. It may result from various factors, including underlying medical conditions, structural issues, or nerve-related problems. Chronic low back pain can significantly impact daily activities, quality of life, and emotional well-being. It often requires a comprehensive and multidisciplinary approach to management. It's important to note that the classification of low back pain into these categories is not rigid, and there can be some variation in how these terms are defined. The duration and progression of low back pain can vary among individuals, and the appropriate treatment and management approach may also differ based on the specific circumstances and underlying causes. Muscle strain, also known as a pulled muscle, refers to an injury or overstretching of a muscle or its tendon, resulting in damage to the muscle fibers. It is a common condition that can occur in various parts of the body, including the back, neck, shoulders, arms, and legs. Here's some information about muscle strains. The causes. Muscle strains often occur due to sudden or excessive muscle contraction or stretching beyond its normal range of motion. Common causes are forceful or sudden movement, such as lifting or a heavy object or participating in intense physical activities or sports. Improper technique during exercise or sporting activities. Overuse of muscles without adequate rest and recovery. Weak or imbalanced muscles that are unable to support the demands of the activity. Symptoms of a muscle strain can vary in severity depending on the extent of the injury. Common symptoms are pain or tenderness in the affected muscle, swelling or inflammation around the injured area, muscle stiffness or tightness and limited range of motion or difficulty with certain movements, muscle spasms or cramping. Treatment for a muscle strain typically involves a combination of self-care measures and medical interventions, depending on the severity of the injury. Here's some common general treatment options. Resting the injured muscle is important to allow it time to heal. Avoid activities that exacerbate pain or further strain the muscle. Apply ice packs to the injured area during the first 48 to 72 hours. That can help reduce pain and inflammation. After the initial period, heat therapies such as warm compresses or heating pads can help promote blood circulation and relaxation of the muscles. Over-the-counter pain medications such as acetaminophen or non-steroidal anti-inflammatory drugs or NSAIDs can be used to manage pain and reduce inflammation. Follow the instructions and consult a healthcare professional if necessary. Apply compression with an elastic bandage and elevate the injured area to help reduce swelling and provide support. As the pain subsides, gentle stretching and range of motion exercises can help promote healing and prevent stiffness. However, it's important to avoid stretching too aggressively or causing further strain to the muscle. Low back pain is a common condition characterized by discomfort, pain, or stiffness in the lower back region. It can range from mild to severe and may be acute, which is short-term, or chronic, which is long-standing. Here are some key points about low back pain. Causes. Typically from a muscle or ligament strain, this is due to overuse or improper lifting techniques or sudden movements that can strain the muscles or ligaments in the lower back. Disc herniation. The discs, which act as cushions between the vertebrae, can bulge or rupture, pressing on nearby nerves and causing pain. Degenerative conditions are conditions like osteoarthritis or spinal stenosis can lead to the breakdown of spinal structures and result in low back pain. Mechanical issues such as poor posture, improper body mechanics, or spinal abnormalities can contribute to low back pain. Injuries or trauma, so falls, accidents, or direct impact to the lower back can cause pain and injury. As far as treatment and management, rest and activity modification is something that's important, especially in the short-term period of rest, may be beneficial, followed by gradually increasing activity levels. Avoid prolonged sitting or activities that aggravate the pain as needed. Pain relief, over-the-counter pain medications, non-steroidal anti-inflammatory drugs may help alleviate pain and reduce inflammation. Exercises and therapeutic modalities prescribed by a physical therapist can help strengthen the muscles, improve flexibility, and promote proper posture and body mechanics. Apply heat or cold packs to the affected area can help alleviate pain and reduce inflammation. Techniques such as massage, spinal manipulation, or mobilization may provide pain relief and improve mobility. Maintaining a healthy weight, practicing good posture, and engaging in regular physical activity can help prevent pain and manage low back pain. Chronic low back pain can impact emotional well-being. Psychological interventions such as cognitive behavioral therapy may help manage pain and improve coping strategies. In some cases, medications such as injections or surgical interventions may be necessary, particularly for severe or persistent low back pain. It's important to make sure that your client consults with a healthcare professional, such as a primary care physician, orthopedic specialist, or physical therapist, for an accurate diagnosis and appropriate management plan based on your specific symptoms and needs. They can provide personalized recommendations and treatment options to address the low back pain effectively. Movement and exercise play a crucial role in the management and rehabilitation of low back pain. However, it's important to approach exercise with caution and follow guidelines that are appropriate for your specific condition and stage of recovery. Here are some general guidelines for movement and exercise in the context of low back pain. Spinal stabilization refers to exercises and techniques aimed at strengthening and stabilizing the muscles that support the spine, particularly the core muscles. The goal of spinal stabilization exercises is to enhance the control and stability of the spine, improve posture, and reduce the risk of low back pain and injuries. Here's an overview of spinal stabilization. The core muscles, including the deep abdominal muscles called the transversus abdominis, the pelvic floor muscles, multifidus muscles, and diaphragm, play a crucial role in providing stability and support to the spine. These muscles work together to maintain proper alignment and control of the spine during movement. The neutral spine position refers to maintaining the natural curves of the spine while avoiding excessive flexion, extension, or lateral bending. It is the optimal alignment for minimizing stress in the spinal structures. Spinal stabilization exercises often emphasize maintaining a neutral spine position during movements and exercise. Spinal stabilization exercises typically focus on activating and coordinating the deep core muscles. These exercises may involve gentle and controlled movements that target specific muscles or muscle groups that maintain stability of the spine. Examples include pelvic tilts, drawing in maneuvers, and bracing techniques. Spinal stabilization exercises can be progressed over time to increase the difficulty and challenge to the core muscles. This may involve adding resistance, increasing repetitions or hold times, or incorporating more dynamic movements. Gradual progression helps improve strength, endurance, and functional stability. It's important to integrate spinal stabilization exercises with functional movements and activities to enhance the transfer of stability and to control real-life situations. This can involve incorporating stabilization techniques into activities such as lifting, carrying, or sport-specific movements. Initially, it may be beneficial to learn stabilization exercises under the guidance of a healthcare professional or qualified exercise specialist. A lumbar disc injury refers to damage or disruption to the intervertebral discs in the lumbar region of the spine, which is the lower back. The intervertebral discs act as shock absorbers between the vertebrae, providing cushioning and flexibility to the spine. A lumbar disc injury can involve different types of disc problems, including disc herniation, bulging disc, or degenerative disc disease. Here are some key points about lumbar disc injuries. Disc herniation occurs when the inner core, the nucleus pulposus of a disc, pushes through the outer ring, the annulus fibrosus, and presses on nearby nerves. This can cause localized low back pain as well as radiating pain, numbness, or tingling sensations that may extend into the buttocks, legs, and feet. The severity of symptoms can vary depending on the location and extent of the herniation. A bulging disc refers to the protrusion of the disc beyond its normal boundary, without the inner core breaking through the outer ring. It may or may not cause symptoms. However, if the bulging disc compresses nearby nerves, it can lead to pain, sciatica, or other neurological symptoms similar to disc herniation. Degenerative disc disease is a condition characterized by the gradual breakdown and deterioration of the intervertebral discs over time. It is a natural part of the aging process, but it can lead to low back pain, stiffness, and reduced flexibility. Degenerative changes in the disc can also contribute to the development of disc herniations or bulging discs. Lumbar disc injuries can result from various factors, including trauma or injury to the back, such as lifting heavy weights with improper technique or sudden impact, repetitive strain on the spine, poor posture, age-related degeneration, or genetic predisposition. A lumbar disc injury is typically diagnosed through a combination of thorough medical history, physical examination, and imaging studies such as X-rays, MRI, or CT scans. These tests help evaluate the condition of the disc, identify the presence and location of any herniation or bulging, and assess the extent of nerve compression. Treatment options for lumbar disc injuries depend on the severity of symptoms and the individual's specific condition. Non-surgical treatment approaches often include rest, pain management with medications, physical therapy to help improve strength and flexibility, and the use of modalities like heat or cold therapy. In some cases, more conservative approaches such as epidural steroid injection or chiropractic care may be considered. Surgery may be recommended in severe cases or if conservative measures fail to provide relief. To help prevent lumbar disc injuries or reduce the risk of exacerbating existing conditions, it's important to maintain good posture, practice safe lifting techniques, engage in regular exercise to strengthen the core and back muscles, and avoid prolonged sitting or sedentary behavior. It's also advisable to maintain a healthy weight, as excess weight can put additional stress on the lower lumbar. When dealing with a lumbar disc injury, it's important to approach movement and exercise with caution to prevent further aggravation of the condition. Here's some general guidelines for movement and exercise. First, consult with a healthcare professional before starting an exercise program who can evaluate the specific condition and provide personalized recommendations. Listen to the client's body and pay attention to pain. Avoid any movements of exercise that cause sharp pain or increased pain. Some discomfort and mild soreness may be expected during and after exercise, but it should not exacerbate their symptoms. Perform gentle range of motion exercises that promote flexibility and mobility of the spine without placing excessive stress on the injured disc. Examples include gentle spinal rotations, forward and backward bending of the spine, and gentle lateral bending. Focus on strengthening the core muscles, including the deep abdominal muscles, pelvic floor muscles, and back muscles to provide support and stability to the lumbar spine. Core stabilization exercises such as abdominal bracing, gentle pelvic tilts, and modified planks can be beneficial. Start with low impact exercises and gradually progress in terms of intensity, duration, and complexity as tolerated. Slowly increase the number of reps or sets, but be mindful of any pain or discomfort. Gradually, progression allows the body to adapt and build strength without overloading the injured disc. Avoid activities that involve repetitive jarring or high impact, such as running or jumping, as they can increase stress on the lumbar disc and worsen symptoms. Instead, opt for low impact exercises like walking, swimming, or stationary cycling. Practice good posture throughout the day, with whether sitting, standing, or performing exercises. Avoid slouching or excessive bending of the spine, as it can place additional stress on the lumbar discs. Refrain from lifting heavy objects or engaging in activities that require excessive strain on the lower back. If lifting is necessary, use proper lifting techniques, bending at the knees and using the legs rather than the back to lift objects. Modify exercises to accommodate the condition. For example, if certain movements or positions cause discomfort, try performing them with support, such as lying on the side instead of the back, or using a stability ball for added support. And working with a physical therapist or exercise specialist with experience in managing disc injuries can be beneficial. They can provide guidance on proper form, exercise progression, and additional techniques such as manual therapy or traction if deemed necessary. Spondylosis, also known as spinal osteoarthritis or degenerative disc disease, is a condition characterized by the degeneration of wear and tear on the spinal discs and facet joints in the spine. It is a common age-related condition that affects the bones and cartilage of the spine. Here's some information about spondylosis. The exact cause of spondylosis is not fully understood, but it's primarily attributed to the natural aging process and accumulative effects of daily wear and tear on the spine. Other factors that may contribute to the development of spondylosis include the discs and joints in the spine undergo degenerative changes over time, leading to the breakdown of cartilage and loss of disc height. Repetitive movements, poor posture, and activities that place constant stress on the spine can accelerate the degeneration process. Previous spinal injuries or traumas, such as fractures or dislocations, can increase the risk of developing spondylosis. There may be a genetic predisposition to developing spondylosis, as certain individuals may have a higher likelihood of experiencing early onset degenerative changes in the spine. Symptoms. Spondylosis is often asymptomatic and may be detected incidentally on imaging studies. However, when symptoms do occur, they can vary depending on the location and severity of the degenerative changes. Common symptoms of spondylosis include pain, persistent and intermittent pain in the neck, back, or affected area of the spine. The pain may be localized or radiate to the shoulders, arms, buttocks, or legs. Stiffness and decreased range of motion in the spine, which can be particularly noticeable in the morning or after prolonged periods of inactivity. Numbness, tingling, or weakness in the extremities, which may indicate nerve compression or irritation due to spinal changes. Difficulty bending, twisting, or performing movements that require spinal mobility. In some cases, spondylosis in the neck region, cervical spondylosis, can cause headaches, particularly at the base of the skull. Spondylolisthesis is a spinal condition characterized by the forward displacement of one vertebra in relation to the one below it. It occurs when a vertebra slips out of its normal position, typically in the lower back or lumbar region of the spine. Here's some information about spondylolisthesis. It can have various causes, including congenital. Some individuals may be born with a defect or abnormality in the bones of the spine, making them more prone to spondylolisthesis. Degenerative, the gradual breakdown and degeneration of the spinal disc and facet joints due to aging can contribute to spondylolisthesis. Traumatic injuries such as fractures or severe trauma to the spine can lead to the displacement of vertebra. This type of spondylolisthesis is caused by a defect in the pars interarticularis and small bony bridge connecting the upper and lower facets of a vertebra. It can be caused by repetitive stress or acute fractures in this area. Certain conditions such as tumors or bone diseases can weaken the bones and cause spondylolisthesis as well. When it comes to movement guidelines for individuals with spondylosis and spondylolisthesis, it's important to strike a balance between maintaining spinal stability and promoting flexibility and strength. Here are some movement guidelines that may help. Avoid excessive or repetitive bending and twisting. This places stress on the spine and exacerbates problems. Instead, try to maintain good posture and use proper body mechanics when lifting or performing activities that involve bending or twisting. Engage in low aerobic activities, such as walking, swimming, or using an elliptical that can help improve cardiovascular fitness without placing excessive stress on the spine. Start with shorter durations and gradually increase as tolerated. Focus on core strengthening, such as muscles that include the core, including the abdominal, back, and pelvic muscles that can provide stability and support to the spine. Exercises such as planks, bridges, and gentle abdominal exercises can be beneficial. However, it's important to avoid exercises that involve excessive spinal flexion or extension, such as sit-ups or crunches. Perform exercises for spinal mobility and flexibility. Gentle stretching and range of motion exercises can help maintain spinal flexibility. Use proper ergonomics. Maintain a good posture and ergonomics during activities such as sitting, standing, and working at a desk. Ensure that the workstation is set up in a way that promotes proper spinal alignment and minimizes strain on the back. Be mindful of activities that may aggravate your client's symptoms and modify them accordingly. This may involve avoiding certain sports or recreational activities that involve high impact or repetitive motions. And make sure that you're paying attention to your client's symptoms and adjust their activities accordingly. If an exercise or movement exacerbates the pain or discomfort, modify or avoid it. It's important to note that the specific movement guidelines can vary depending on the severity of the condition. Individual factors and guidance of a healthcare provider or a physical therapist can be beneficial as well. They can provide a comprehensive assessment and create a customized exercise program tailored to your client's specific needs and limitations. Spinal fusion, also known as back fusion, is a surgical procedure performed to permanently connect two or more vertebrae in the spine. The procedure is aimed at stabilizing the spine, reducing pain, and improving spinal function. The procedure itself, by the surgeon, uses bone grafts or synthetic materials to join the vertebrae together. The surgery typically involves the following steps. There's an incision that's made in the back over the affected area of the spine, and the surgeon removes any damaged or degenerated discs or tissue between the vertebrae. Bone graft material is placed between the vertebrae to promote fusion. The graft material can be obtained from the patient's own body, like an autograft, or from a donor, an allograft. In some cases, synthetic materials or bone graft substitutes may be used. Metal rods, plates, screws, or cages may be used to provide stability and facilitate fusion between the vertebrae. The incision is closed and the surgical site is bandaged. Recovery from back fusion surgery can vary depending on factors such as the extent of the procedure, the patient's overall health, and adherence to post-operative instructions. The length of the hospitalization can vary, but it's typically a few days. Medications will be prescribed to manage pain during the recovery period. These may include opioids for acute pain and non-steroidal anti-inflammatory drugs for inflammation. A brace or cast may be required to provide stability to the spine and promote proper healing. The duration of immobilization will depend on the specific surgical technique and the surgeon's recommendations. Physical therapy is often an essential part of the recovery process. It helps to strengthen the supporting muscles, improve flexibility, and restore normal function. The timing and intensity of physical therapy will be determined by the surgeon or physical therapist. Certain activities such as heavy lifting, twisting, or bending may need to be restricted or avoided during the initial recovery period to prevent strain on the fused area. Gradual return to normal activities. It may take several weeks before they can resume normal activities, and the timeline will depend on the individual's healing process. The surgeon will provide specific guidelines for gradually increasing activity levels. The goals of back fusion surgery are to stabilize the spine, relieve pain, and improve quality of life. However, It's important to note that the procedure may not completely eliminate pain in all cases. Success rates and outcomes can vary depending on factors such as the underlying condition, the patient's overall health, and the surgical technique used. As with any surgical procedure, back fusion surgery carries potential risk and complications, including infection, blood clots, nerve damage, spinal instability, and failure of fusion. It's essential to discuss these risks with the surgeon before deciding to undergo any procedure. It's important to consult with a qualified spine specialist or orthopedic surgeon to determine if back fusion is necessary and is appropriate for the specific condition, and understand the potential benefits, risks, and expected outcomes. They can provide the personalized recommendations and help to guide through the decision-making process. And this is a spinal fusion that I went through in January of 2023. You can see it was the lumbar 4, 5, and S1 at 3 levels. And I'll just say I had 5 years of back pain with a couple of other surgeries, minor surgeries, to help alleviate that, and really did not take care of it. So I'd hoped that this would help. Unfortunately, at this point, I have to say I have a little bit more nerve damage in my foot than I had hoped for. I actually did the surgery to help with it, and anyway, it's been 6 months now and still not there yet, but I am walking and getting stronger and hoping to have some type of recovery later on. Low back pain is a common condition that can be managed through movement and exercise. However, it's essential to approach exercise with caution and consider any contraindications or indications. Here's some general guidelines for movement and exercise for low back pain, as well as contraindications and indications to keep in mind. Stay active. Bed rest is no longer recommended for low back pain. Instead, it's important to stay as active as possible within your pain limits. Gradually increase the activities and exercise tolerance over time. Consult a healthcare professional. Before starting any exercise program, it's advisable to have your client consult with a healthcare professional, such as a physical therapist or doctor. They can assess their condition and provide personalized recommendations. You want to begin with gentle exercises and gradually progress as their pain allows. Over time, they can increase the intensity, duration, and complexity of their exercises. Strengthening the muscles of the core, including the abdominal and back muscles, can help support the spine and improve stability. Exercises like abdominal bracing, planks, and bridges are beneficial. Perform gentle stretching exercises that target the muscles around the hips, buttocks, and lower back. Hamstring muscles or hamstring stretches, hip flexor stretches, and piriformis stretches can be helpful as well. Engage in low-impact aerobic activities that promote cardiovascular fitness without putting excessive stress on the back. Options include walking, swimming, stationary biking, and water aerobics. Pay attention to your posture during everyday activities. Practice good mechanics such as lifting heavy objects with your legs and not their back. Exercise contraindications for low back pain. If you experience any pain or worsening pain during or after exercise, it's important to stop and seek medical condition. Pain that radiates down the leg, causes numbness or weakness, or is accompanied by loss of bladder or bowel control requires immediate medical attention. If your client has an acute injury, inflammation, or an undiagnosed condition causing low back pain, it's best to avoid exercise until they receive appropriate medical evaluation and treatment. Some medical conditions such as spinal fractures, severe osteoporosis, spinal tumors, or inflammatory diseases may require modifications or avoidance of certain exercises. Make sure that they consult with a healthcare professional to determine what exercises are safe for their specific condition. Chronic low back pain. Exercise can be beneficial for chronic low back pain that is not caused by a severe medical condition. It can help improve flexibility, strength, and overall function. If your client has muscle imbalances or weakness in the core or supporting muscles, targeted exercise can help address these imbalances and provide relief. Regular exercise and physical activity can help prevent future episodes of low back pain by improving spinal stability, flexibility, and overall fitness. remember, it is crucial to listen to the body and work within their pain limits. If they have any concerns or questions about specific exercises or their condition, it's recommended that they consult with a healthcare professional for personalized guidance. Assessing posture effectively involves observing and evaluating the alignment and positioning of various body parts in relation to each other. Effective assessment is essential for establishing appropriate pain-free low back and pelvic stabilization and flexibility exercises. And that is all that I have for you today. I look forward to talking with you again in part 3. Have a great day.